Brittany, if you can check it out for me, I would really, really appreciate it. Yeah. So I'm starting to see your comments. Hi, Phoenix. It's so good to see you guys. Thank you for being back here. I really appreciate it. Lois, I see your request to go live with me. I don't accept requests spontaneously because I really prefer to know people before I bring them on. And sorry about the interruption here with you guys over here on YouTube. I'm back. Hopefully your sound is there. Would you let me know if you can hear the sound or not? It would be nice to know if I'm back live or not. But so I'm going to scroll backwards, TikTok, and see what you've been saying. So Linda says, I've been depressed and I can't find happiness. And then, hey, it's Kate says that, okay, Kate says, it's, can you help me give some advice on conflict resolution with a parent who has narcissistic traits and borderline feature traits, and I'm an adult child? Oh, Kate, man, that's a brutal one. Oh, great. Thank you. I'm so glad you guys can hear me. I don't know what went wrong, but I had to start and restart. So I'm glad you're still with me. Thank you so much, Cleveland. Thank you for letting me know there's a problem. So yeah, I started out by talking about the fact that there is a blend of understandings of theories. Let me just recap real quick to catch everybody up to date. There's a blend of theories. Psychology is sort of like it's almost like the Wild West. And so imagine that we're trying to make sense of some mysterious thing. And so somebody says, they look at, let's say we're a bunch of blind men looking at an elephant, and we say, oh, this really has a long kind of like a hose-like thing, and it moves about. And then everybody else, no, it's like this big wall, and it's really immense, and it's hard. And then somebody else says, oh, but it's really got these flappy things that kind of like flutter in the wind. I mean, that's how it kind of we've approached psychology, is that people, starting in the early 20th centuries, they started looking at it from these various perspectives. We have the behavioralists that found out, oh, you can condition things, you can make people respond in certain ways, and we're built up of habits. And somebody else said, oh no, we're meaning making machines, and everything is symbolic, and we're trying to make sense of it, and we have this part of our ego called the id and the ego and the superego. And then you've got somebody else who says, no, we really have a sense of belonging, and we're really looking for meaning in the greater thing of life. And that's where the existentialist came in. So we have all these different perspectives. And the interesting thing is, I think they're all right. I think everybody accurately described a part of the elephant. And I think everybody accurately describes humanity, that we're this highly complex organism that it struggles to make meaning. We're wired for belonging, and but we're also at the same time trying to have a cohesive sense of self, and we have all these skills and sense of self. So today we're going to talk about that. Talk about how do we then integrate the fact that there's all these perspectives of what makes us human and what makes us ill or not ill in the instance of narcissistic personality disorder, and how do we begin to understand those that we've been in a relationship with, understand ourselves, and how do we move forward in the most healthy possible way. So that's what we'd like to talk about today. It's kind of this comorbidity. It's called comorbidity, meaning you have a dual diagnosis, or sometimes in some people's case, they have multiple diagnoses. So I know that some of you have already been asking questions. Like I said, it's possible to have NPD and also have anxiety. It's also have NPD and autism. It's possibly autistic and have anxiety, or other types of conditions that these things can co-occur at the same time. So it's hard then for treatment. That makes treatment really challenging. It also makes it hard for those around them, this individual, to know what's the best way of behaving. Should you personalize what's happening? Should you give them leeway and just be supportive and understanding because maybe they can't help it? I mean, how do you navigate how to do this in the best way that shows your self-respect, but also is sensitive to those that you love? That's super challenging. And when we get caught up into the wrong direction, it can really lead to us compromising ourselves, which ultimately leads to self-betrayal. And then that's a bad spot where you end up feeling like you're the last person on a list, and that you're being violated. And we don't want that, because that's abuse either. In fact, I caught a bit of a live today. She was on a rant, actually, about victims being victims and how we need to quit being victims. And yeah, there is some truth of that this gets tricky, and we don't want to victimize ourselves because of our sensitivity and our extreme compassion. So let's dive into this. And I know you guys have already been hanging out with me now for several minutes, and some of you have asked questions that I haven't responded to. So let me go backwards and attempt to grab them and then move forwards. So thank you so much for joining me again. I'm Dr. Kerry Kerr McAvoy, and a licensed psychologist, and I really appreciate you guys hanging out with me together. Okay, I see the start. So how do you resolve someone who has not worked on their borderline traits and their narcissistic traits? Kate, that's really tough. That's a tough situation because what you're essentially saying to me is that this is a person who probably doesn't see their disorders as their difficulties as a problem. They probably are then externalizing everything they're doing as you being the problem. So when there is a conflict, then you're the one who's bringing it up and have the issue because they themselves don't see themselves as the problem. So it really requires those of us who are around individuals like this, when we really don't have a chance to sort of go no contact and to avoid them, to accept that we're going to be, I'm trying to find the right word for it. We're going to be labeled the problem. It's just you are going to be the one they will place the burden on you for having an issue, and finding a way to come to terms with that while not owning it and having it become part of your identity. I know that's the tricky part. It's like, here's this person saying you're problematic for making issues, when really you're just trying to cope with all their chaos and drama and the bad decisions they make and the impulsivity. And then they blame you, and you become then the patient, the problem, the identified problem in the situation. So finding a way to know that that's going to happen, not take ownership of that, just see that as the inherent dynamic of being in a relationship with somebody like this. And here's the thing about, you said, how do I have advice on conflict resolution? People who have personality disorders don't have conflict resolution. There isn't resolution to conflict. So becoming okay with the fact that there isn't going to be resolution to your conflict is a big piece of you working through it. To know that, okay, so there's an argument coming up about some family event, knowing that she's going to come, your mom's going to have her opinion, and you're going to know what's right for you, and then doing what's right for you, knowing it's going to lead to your mom being mad. That there probably won't be a meeting of the mind. That's not the meeting of the mind would be for you to give up what's good for you. Now, maybe in some cases, that's what you have to do. You know, if she ends up in the hospital dying and she makes an odd request of you, you may say, the situation requires me to show up in a way that I normally wouldn't, and then you'll do it. But maybe in normal situations, like a family event, you say, no, that's too costly, and her request is too big, and I'm just not going to do that. So I think the resolution of the conflict really has to do with the work you do within yourself about how you're going to handle that. So it's tough, though. I agree. I wish I had a better answer. They don't give better answers. That's the problem, is that there is no better way to working through this. Yeah. Hi, guys. So your ex was a psychologist and wasn't healthy. You know, I'm going to stop on this. Thank you for bringing that up. Hi, guy. I really appreciate that. I need to warn you all that psychology is a field and psychiatry is a field attracts ill people for a couple reasons. One is because we want to make sense of our own past and history. So we find it a very interesting field to sort of heal ourselves. And I saw that a lot at graduate school. And the other reason is because the position of psychologist and psychiatrist offers a lot of power. But think about it. People come in, pay you decent fees to give them input, get their input on a problem. You're essentially saying in that moment, I'm not saying I'm God, but there's a godlike aspect to it. I get to diagnose you. I determine a treatment plan. If you don't behave the way I like, I can call you a resistant patient. We even have frameworks to pathologize patients. That's pretty powerful, you know? And then I can even say the reason you're not getting better is because you haven't followed my plan. You know, that's pretty godlike. So it attracts, unfortunately, narcissists. Of those that I know that I worked with, you know, maybe the 20 people or so, I can list 4 or 5 right off the top of my head I knew were narcissists or not well. Now, why is that? Somebody said to me in a comment on a video that we should criminalize that. Shouldn't graduate schools or residency schools, medical schools get rid of them? Well, they try the way that they can. I mean, first of all, I got to remember that they're tuition driven. A lot of them are. I mean, yes, there is competitions to get in, but once you're in, well, now you've made a commitment to the student who's going to be there for 6 years or whatever. So now, okay, so now you have an attachment to this student succeeding. You've got a buy-in on this, and yeah, there is some ways in which we kind of try to drum people out. I remember one of my classmates clearly was not meant to be a clinician. He was going to be an excellent researcher, but he was not cut out to be a clinician. I mean, I don't know what was wrong, but he had just no bedside manner at all. And the program did drop him. It told him this was a bad fit and suggested he go elsewhere. I think that he did. I think he went into a research program, which was a much better fit for him than to be into clinical work. But a lot of people get through. A lot of people. I knew one of the best psychiatrists I ever worked with knew openly, said openly to his staff that he was a narcissist. He had NPD. His father did, who was a psychologist, and then he was a psychiatrist, and he knew he had NPD. And I'll tell you, he was a scary dude. Had a lot of power. So I don't know what to say except to be aware. I think, but all of you becoming aware that this is a risk is really helpful for you to go in and say, here's the thing. Okay, we're all human. I'm human. That means I struggle to get my act together just as much as anybody else struggles to get their act together. Holding me to some standard to say that somehow I know more or that I'm a healthier person or I have a better ego structure. Well, I hope, but I'm human. And that's how I got into that terrible relationship, because I'm human and I have the same needs as everybody else and I have the same blind spots as everybody else. But what I have found is if I can keep at least one step ahead, then I can help those around me. So my job is to always to hold myself to a high standard and always work on myself so that hopefully I can stay just ahead of the curve. Because here's the thing, the minute the client is healthier than the therapist, treatment fails. So if you're feeling treatments fails, maybe one of the possible reasons could be that you're not with the right person who knows what you're struggling with, and it's just not, or it could be just not a good fit between you and the clinician, but it could be because you're healthier than the clinician. I bet you never thought of that. It could be that you have your act together a little bit more than they do, and that's causing a misfit, a poor fit. How do you tell the difference between a vulnerable narcissist and a borderline personality disorder? Ooh, I love that question. Wow. Great question. Who asked it? Let me go back. I hope the person who asked it, because this is a while back. Oh, it's Shawnee. Shawnee asked it. Okay. So a narcissist versus a borderline personality disorder, covert narcissist or a vulnerable narcissist. Vulnerable or covert narcissists lead with the victim identity. So it appears sensitive. Now, yes, borderline personality disorders often lead with a victim identity as well, because a lot of bad things usually happen. See, for a narcissist, the story of bad things happening is usually not all that. I mean, yeah, they have some things that happen bad, but they also do a lot of bad things. Borderlines often are victims. They really do often have a lot of bad things that happen to them. In fact, at one point, it was theorized, I don't believe this is true, maybe for some, maybe a small percentage, but at one point it was theorized back in the 90s that borderline personality disorder was created because of trauma, because of significant high levels of trauma. I think now we know that that's CPTSD, not BPD, but we used to think maybe CPTSD was BPD. There was some questions about that. I think nowadays we kind of like put them into their own categories and understand that they're a little different from each other, but the primary problem with borderline personality disorder is dysregulation. So dysregulation of emotional affect, emotions, dysregulation often in kind of how they organize their life. And they attach intensely to people, but it's kind of fear-based attachment. Like, I'm not saying they have an anxious attachment. Please don't hear me say that. But there's this fear of abandonment, but fear of losing themselves. It's kind of this twin fear. of if you get too close and really know me, you might leave me. But if you get too close and really know me, you might take over and I cease to be, which unfortunately makes them the perfect candidate for narcissists. That's often it's a matchup. It's a common matchup. Now, again, I'm not saying anybody who's been in a relationship with a narcissist that you're borderline. I'm not saying that. I'm just saying that borderlines, narcissists tend to solve some of the problems that borderlines feel, which is they want someone who sort of seems safe. Now, narcissists are really not safe, seems safe. Narcissist sense of control at first appears like safety. I know I said that. He's the safest guy I ever met. No, he was probably the most dangerous guy I ever met, but he seemed safe. That sense of safety is very appealing. And yet they also at the same time, so that you like, oh, I'm not going to be abandoned, but then they're so controlling that they then like engulf the borderline personality disorder. So it's this really rough dynamic when it happens. So how is it different than covert? So covert is a facade. And borderline personality disorders don't usually use facades. They usually are as who they say they are. They usually come in, they're very easy to get to know people. They create this really wonderful connection with you. It's not love bombing. They just are very easy and good they're very vulnerable, and we connect with that authenticity. But when we end up finding that they have these twin fears that they react and get really dysregulated and can create a lot of chaos around that because they're running so scared. And so part for their work is they need to kind of get a hold of that and do the hard work of learning how to sort of regulate all of this. Whereas for a vulnerable narcissist, no, it's that it's all about them all the time, and it isn't about dysregulation. It's really about control and use of you. And so I know I probably haven't helped you I probably haven't helped you identify them because they're tough. But I would say time is your friend. With time, you're going to either see this person is authentic and just struggling. And yes, drama is a result of the struggle with their impulsivity. Or you're going to find out that there's this game playing happening and that there's a lot of gaslighting and a lot of manipulation and exploitation and deception. So I think with time, you'll sort of see the intent. The intent's different. But fascinating question. Thank you for that. In Instagram, you've been awfully quiet. Do you guys have any questions over there for me today? Yeah, and I answered the question. So depressed, Linda, you said you're depressed, you're struggling to find happiness. I would highly recommend that you see your physician, you get to see a therapist, or you see a psychiatrist, and that you look into medication. I don't know if you've tried medication, but often there's sort of three types of depression. There's depression that ends up related to situation. We just have a lot of crappy things happen and you start to respond with being depressed. It can happen because it's just the hard wiring. You're prone to depression. That's what we call more of like it's a more of a innate form of depression. And then there's depression that's kind of it's a mix of both. So it's really important to have somebody come in and say, okay, we think it's more based upon your makeup, your nature, or maybe that it's more based upon what you're going through, and then maybe you need more help with what's happening in your life. But it's really helpful to get an expert opinion, and so they can assess whether or not medication's indicated in that situation. So Phoenix asked, ADHD suspected with autism and CPTSD is not for sure. I'm struggling to rectify my own toxic traits, and who's the problem? Yeah, that can get really tricky. And I love that you're looking at all of that. And there is, like I said, narcissism and autism and ADHD are like neighbors. They like to live near each other, and they often can kind of like show up together. I'm not saying, I'm just thinking you're saying ADHD and autism. So yes, that's a common overlap of the two. Again, they're separate conditions. Neither causes the other condition. Please don't hear me saying that. I'm not saying that. But they can like kind of co-occur and show up together. And you're right. That makes it tricky to know, kind of contain the impulsivity, but then you're also struggling with social awareness and maybe other sensory cue problems. And maybe you're even having some neuromuscular delays or struggles and those types of things that happen with that. So that's interesting. It is, and it's important. You all know that I've shared that I'm autistic. It's really important for us to kind of own the way that manifests for us. And for me, I'm strongly introverted, and then I also can have some social anxiety. So it's important for me to sort of respect that, but also push the boundaries of it, but also take responsibility for it. So I appreciate what you're saying. That's great. What's the difference between narcissists surrounding themselves with yes men and non-narcissists who are cutting toxic people? Oh, man, that's a wow. Oh, well, that's a great question. So, yeah, you're right. It says from the outside, it can look a lot the same, can it? Okay. So let me kind of think about this. Um, I have it. I would love to know, were you being sincere or are you just trying to provoke an argument? Because that's a little provocative, but I also think it's a good question. And they do look the same. I think the hard part, let me kind of stand way, way back from it for a second. Narcissists have yes men because they can't hear no, not because the people around them are being abusive, but just because they don't like anyone threatening their leadership or their sense of control. I've known them. I've known them personally in my life, and you're right, they do that. They have like sycophants that just sort of like this entourage. They move with an entourage. And again, it's not because anybody in their entourage is causing any problems. No, no, everybody in the entourage knows the rules. If you want to be close to this person, you better, like the mean girls, the queen bee, you better follow the rules. If she says wear pink on Wednesday, you better show up wearing pink on Wednesday. And with the men is if we all like laugh at his jokes or like his type of whatever his drinks, then you better laugh at his jokes and you better appreciate his drinks. So that's what happens with narcissists and yes men or yes women, is that these people understand that the condition of the relationship is compliance to the expectation. All right, so let's talk about people who then have been coming out of abuse and they're realizing that they have accidentally surrounded themselves with toxic people and they start to go no contact with these individuals. The difference is this is a person who's been a yes man and they have been overly compliant. In fact, they've probably been called a people pleaser or codependent. And they're realizing that they need to have better boundaries and that probably these people wouldn't have been in their lives had they had the boundaries in the first place. So now they're starting to execute boundaries. And part of the boundaries is say, hey, this person consistently gaslights me, consistently puts me down, consistently minimizes me or invalidates me, doesn't even let me hold the floor and say what I need to say. So therefore, I just don't want to have them in my life. They make me ill because they don't want to work with me. They don't want to play well in the sandbox with me. So I'm going to choose to no longer have them in my life. Completely different motives. Completely. The first is, this is the rule. You're in or out based upon whether or not you comply with the rule. If you want to be with me and be one of the cool guys, the cool people, the queen, in the mean girl club, this is how you do it. And that's the narcissist with the yes people. And the second is, this is the victim who says, I need to get my act together. And that means I need to assess who's in my life and why. And I need to have better boundaries and respect myself. And I've been letting people who probably I shouldn't have been close to me. And so now I need to not have them in my life and have them close to me. Completely different dynamic. But you're right. It look from the outside, it can look the same. It can. I think I have a feeling that your question is one born of irritation, that it is hard that if I don't know your story and I don't know if you've gotten cut out because of that, but it does warrant a question of, is this person really a narcissist and I just didn't play well by the yes rules? Or have I been abusive and maybe not really fully emotionally supported this person? And now the consequences that I've lost the relationship that I valued. I guess that's the question I would have for anybody that's happening to. So, yeah, Brittany, I agree. Is that, yeah, for those of us who go no contact is because we're trying to contain abusiveness. It's not because we're controlling the other people. We're just saying they're not going to control us. And when we do, they end up being very harmful or hurtful to us. It's hard, But yeah, from way, 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 way back, it can look the same. It can look the same, but it is a different process. Yeah, I agree, Sarah. It is Sarah is talking about back to why has unhealthy people in the clinical field, why aren't they called out more? Why is there not more consequences? There is, that there's a governmental system in place in every state in the United States, and I'm sure in many places in the country, around the world, that if you meet an abusive therapist, who's breaking the law, or certainly breaking the frame of treatment, you can report them. That is really, really, really important to do that, to report them. Yeah, I've left practices because of unethical practices occurring in the practice. Yeah, it's tricky. It's a terrible situation. Yeah, I knew of a therapist who got into an intimate relationship with a client. Knew him. I mean, I was working in the practice. I left the practice for it. Awful stuff. So you have to become careful about that. Yeah. Well, Cleo, I'm glad that you like the honesty here. I really try to be very upfront about this as much as I can. Yeah, there isn't, Chris, I agree with you. There isn't just it's tough because it's political tensions in these realms. I mean, when you're in an agency, what happened in that situation is I left the agency no longer allowed room for me to be there anymore. You know, that they're actually created it created tension, and then the practice split. So I had to find a new place to practice. Yeah, I got legal advice on that one too. So I actually talked to an attorney who said, "Get the hell out of there. You're suable. You know, you can't be associated with this group in any way at all." So I knew it was a bad situation. But if you need every single person, please be aware that just because we have a PhD after our name or a PsyD or a doctorate or we're an MD or DO does not mean that we're healthy, and it does not mean that what we're proposing for you is best necessarily the best for you. You have to have a measure of trusting your own gut. You know, it really takes you saying there's something about here that doesn't align with you. Here's an example. I had a treatment failure of my own. So one of the things that happened with me is, you know, I was required by my graduate program to give a year's worth of treatment. And it had to be 50 sessions in a year, which means I could only take 2 weeks off. Otherwise, I wouldn't graduate, or I'd have to start over and do this again. And I'm paying for it. They're not paying for it. I'm paying for it. So it was expensive. So I was seeing this woman, a psychologist. She came highly recommended. And during the period of time, I was expecting my first child. So we dealt with a lot of what it meant for me to be soon to be a new clinician and be a mother and trying to balance all of that. And I was also struggling with my family's relationships, the narcissistic and other personality disorders in my own family, my issues there. And I kept bringing up the same issue over and over and over. That all happens, by the way, guys. You'll go into therapy or you'll go into counseling or coaching and you'll repeat yourself. That's normal. That's normal. Any clinician who has a problem with that, they have a problem. That's not your problem. That's the clinician's problem. So I was doing that. I was going in and complaining about how the critical people in my life weren't changing and I don't know what to do about it. And she broke the frame. She stood up and walked away. Here I am telling this really personal story, looks out the window and says, "When are you going to ever start to realize that you can't change this person in your life?" I mean, she was scolding me. And I actually had thoughts of self-harm. I left the appointment. I dissociated driving home. I actually blanked out, lost time driving home, and I had self-harm thoughts. And then she was gone for the next week for a conference. And when I came back and confronted her, which is a good thing to do. I recommend that. Came back and confronted her. She wouldn't own that she hurt me, that she harmed me, and then said, "You know what? I realize you have an addiction, Kerry. This is your addiction. This is what you should do. This is how you should see someone else. You should go get this help for the addiction." It came out of no I'd seen this woman for over a year, and this came out I mean, you thought that you should have told me that months ago, do you think? So I said to her, this is a really good moment where I had good boundaries. I said, "Oh, that's a great idea. I think I'll use this money that I've been spending here on my health in a different way." And I did. I walked out and didn't see her again. You know what? You had 2 strikes, sweetheart, and you're out. I'm not even going to give you the third. It's gone. So please be aware of that. Please, listen to yourself and know that. Okay, so yeah, I agree. Toxic people aren't the same as people who just say yes. I agree. Do I think it's common for narcissists to also have dissociative identity disorder? Interesting. So DID used to be known as a multiple personality disorder, but even Sybil, the story of Sybil, I'm dating myself. Maybe you guys haven't seen Sybil. There's also 3 Faces of Eve even before that. Hey, so good to see you from Ireland. So there's been other stories from way back about or even Split. They have it's not always like that. I've worked with a couple people who've had DID. doesn't quite present like that, but I do think it is possible for narcissists, if they have a highly traumatic past, like a legitimately highly traumatic past, to also be struggling with dissociation, for sure. I think so. I don't think that they always co-occur. I would not ever say that that's a standard thing. But here's the thing. I mean, anything is possible, Maggie. Anything is possible. So certainly it's possible. But I don't think it's common. I wouldn't say that that's an explanation of why they have narcissism is because of dissociating from trauma. I wouldn't say that. They're saying that narcissism actually is a biosocial problem, meaning what that means is there's probably a genetic predisposition to narcissism, and then something activates it. Life circumstances, difficulties, mismatch in caretaking, trauma. I mean, lots of things can activate it. The probably lack of safety in the home, lots of stuff can activate it. Hey, thank you, Em, for saying that. I appreciate that. Yeah. Do I help? Can Jeannie show this is a great question. Can NPD patients actually be helped from by therapy? Yeah, I think I got fortunate. It's okay. So, as a therapist, you always have patients you work better with than other patients. So you have groups that you just do better with. And one of the groups I did best with was NPD. So I got to see them for years. Some would come in and see me for years. I think I worked maybe 7, 8, 9 years with them, some of them. And you're like, well, how did they get into therapy? Because most of them don't get into therapy. Yes, that's true. Most of them don't seek therapy. But when their narcissistic frame, the framework of their ego starts to fail, they then start to be called what we call like a collapsing narcissist. And when they get to that stage, often then some who are a little higher on self-reflective scale will go seek treatment. And that's the group that I ended up seeing was that group. Or when life really got so painful, it's like they had so many losses pile up, then they might get therapy then too. But never, please hear me, guys, never in response to a partner saying, I don't like you. I think that this is not working. You need to go get help. No, I'm not seeing narcissists come in for therapy for that. They'll say the partner has the problem, not they. They don't have the problem. It's just when multiple things pile up and compound, and then they get to the place of like feeling so bad and so dark. They get to such a dark place that they think either I don't want to live or I'm going to go get therapy. And at that point, some of them will go get therapy. And that's the group that I treated. So I struggled treating borderline personality disorders. They tended not to stay with me and don't tend to, I don't know. It's something about me and them, not that I don't have them in my life. I don't know many of them in my life, but I just wasn't a matchup for them as a clinician. It just wasn't my strong point. I have a colleague that does great with them, but that wasn't me. I saw the narcissist, so yes, I've seen them get better. They make incremental changes. They can develop cognitive empathy. They can get a little more self-reflective. They can build trust. I would say the one that I worked with the longest came to a point where he felt very safe with me and he trusted me enormously. And I know he still at some level keeps track of me in his life, that I have become an important person to him and that he knows that he was an important client to me. And so that is possible to get that kind of connection. It's possible. In fact, here's a mistake I made. Because of his rarity and his ego strength, I then assumed when I got into the relationship with my narcissistic ex that he would do the same and he could be the same. No, he was not the same. No, he could not do the same. And no, he did not have the same motivations as this person. So please be careful with these generalizations. Please don't make them generalizations. So Aku over said that I was with a covert narcissist woman last year who love bombed and mirrored me. And then I was replaced by another guy 4 days after the breakup. And she married him after only 4 months. Yeah, that's not an uncommon. And by the way, Mark, I see you're from Ireland. So nice to see you. That's not an uncommon story, that they really need supply. And covert narcissists, I would agree with you. There's probably more vulnerable narcissists are women than men. We just don't see them. They're kind of hidden to us. In fact, next week, I'm going to be putting up longer content that's going to go live next week on the differences between female and male narcissists. And we'll talk about the fact that females, we tend to, the socialization of women being more softer, more seductive, sexy, all of that tends to blind us to their narcissism. We tend to see that as just being extremely feminine and miss the fact that it's not just extremely feminine, that it actually is toxicity and something we need to be careful with. So Angie asks, what suggestion do I have for victims to regulate their nervous system while still living with and trying to leave the toxic person? That's a tough spot, Angie. I'm so sorry that you're in that situation. Um, I would, yeah, I mean, you're going to continue to be in a state of fight or flight whenever, every time there is any conflict or even with just contact with a toxic person, because they tend to be antagonistic by nature. So that antagonism and the intimidation is going to constantly be flooding your nervous system. I think the best thing I recommend, and I'm sure you're already trying to do that, is to disconnect yourself emotionally from this person, to move out of love, move out of connectedness as much as you can, which means letting the relationship emotionally die, which is never, I would never recommend that to keep a healthy relationship. So I would, I'm really giving you advice to help finish killing the relationship. But the best way that you can emotionally disconnect so that you're apathetic and you don't really care, all of that helps you then get ready to, it gives you protection for one, it gives you distance, emotional distance, but it also helps you get ready more to leave. Hey, thank you so much, Mr. Sheets. I appreciate that. I please, again, I have talked earlier today that I'm launching a membership for less than the cost of one counseling appointment or one coaching appointment a month, where you guys can get direct contact with me. I will be doing direct kind of like office hours, video chat with you as a group. It also gives you access to continuing advice through emails. You'll get the email support. And at a higher level, you'll be getting a lot of training and classes, including breath work, regular breath work, and online courses and all sorts of stuff. So if this is helpful to you, I'm going to be doing less of this in public and really devoting myself to the group. So please consider checking it out. There's a link in the bio if you'd like to learn more. I'm super excited about it. I'm launching it in a month, less than a month. So yeah, Mark, you're asking, was that guy already in the picture? I don't know. She says he wasn't, and that she found him in that brief period of time that you guys were together. It is possible, but it is possible that what I've kind of noticed is serial cheaters have a lineup. It's almost like they're like, I love to fish. I love to fish. I grew up fishing in Canada for so I freshwater fish. But it's almost like they have multiple, hooks out, lines out, and with bait, and they're like having in different stages. People are in different stages. So there's those that they're targeting, those that they're like trying to get on the hook, and those that they have hooked, and those that they have, caught and released. So I hope the fishing analogy doesn't bother you, but that's how it feels to me. It really does. Okay. So, no, I don't know how to say your name, but if someone's verbally abusive in certain topics, shame avoidant, and a special child, are they narcissistic? Not necessarily. Again, that's why I'm saying that you can't make these assumptions that this type of situation will inevitably result in that, because we think it's a biosocial problem, that narcissism has to have some genetic precursors for it. And then there's also some events that probably are triggering. And remember, every event is viewed differently by every person. So maybe what's triggering and upsetting to me wouldn't be triggering and upsetting to you. I mean, you might be at a super loud party and somebody bump you and then say something kind of rude, and you're like, walk out, well, I don't care. And to me, it might like send me in a corner, like crying, so, and it's not simply a man thing, woman thing. It may be literally, I'm saying we all have different thresholds for what's disturbing and toxic and triggering for us. So I don't really know what would cause. I think that's the billion-dollar question, is that we can't identify why people are the way that they are. We know there's some variables, but we also know there's confounding variables, and it's really hard to isolate the cause of some of these conditions. There's multiple causes. That's the problem. There's multiple causes. And just because that certain setup for some person might be a cause for that person, doesn't mean it would be a cause for the next person. Like, let's work it backwards, okay? So I grew up in a shame avoidant home, and there was the golden child in my family was my sister. And yes, there was like tremendous abuse, particularly emotional and neglect, a lot of neglect and sexual abuse going on in my family. And yet none of my sisters and I are narcissistic. Not a single one of us. Well, how did that work? You'd think if that was the combination, we were doomed. And yet I've known some of you get a hold of me who then have told me the number of narcissists in your family, and there wasn't necessarily those situations that happened. So that's, it's not necessarily that combination. It's we don't really know. That's the problem. We really don't know. Oh, Dana, thank you so much. I'm glad you're here with me live, and I'm glad that you've been listening to the podcast. Um, and you really loved the book, Why Can't I Just Leave? Yes, Dr. Milstead did a beautiful job on that book. It's a great book. I would love to know, any of you who is listening to the podcast Breaking Free with Kerry and Tara, what do you think of the changes? Honestly, what do you think of the change? What do you like? What don't you like? What would you like to see be different? I would love any kind of feedback. That would be amazing. So, Mark, you asked, so can you imagine he was already some in the pictures? When I reached out to her a few weeks later, she said she was just rude and dismissive. Yeah, because whenever, this is the weird part. And I don't get this about narcissists, because this is not how most people see people and see relationships, is they idealized you. They like made this perfect picture of who they thought you were going to be. And that's this perfect relationship that you're going to have. And then it unfolded and they found out that you were human, like every other human. And somehow they made a caricature out of you, an idealized picture. And there's almost this, they've attached shame to this process, which then they've attached shame to you. It doesn't belong to you. It's really their unprocessed shame about the way that they approach relationships. But they've attached it to you, which helps instigate, helps set up the discard. So now you didn't fulfill that perfect image, which you didn't even know about and is unrealistic. Now there's shame about the fact that you're not all perfect. And then they get rid of you in hopes to finding the new person somehow is going to be a better fit for this perfect image, which, by the way, they won't be, because again, this is all an internal problem. And so then they act like you're shameful or a shame thing after the event is over, and are dismissive and rude, because in their minds you've literally, and like this is what a psychologist who is one of my mentors told me. So I'm going to say it exactly the way he said it. Watch out whenever you're a nugget of gold to somebody, because in the next moment you'll turn to a piece of shit. Watch out for that. So if somebody is overly like, oh, I've never met somebody like you, you're the perfect person, even like was a therapist. If I ever heard that, like, oh man, here it comes, I'm going to, like, the nugget of gold becomes the shit. Just watch out for it. So unfortunately, that's what you're experiencing. And the dynamic, all of it is an internal process that gets worked out externally. So they apply it to you, which is so unfair and so painful and so horrible. And I'm so sorry that you experienced that. So what is my thoughts? And Chris, I agree. It's just wrong. It's wrong on so many levels. It really is. If narcissists are working out their interior problems and dysfunctional worldview onto people, they actively replicate it in their relationships. That's the sad part. It wasn't a real relationship between two people who actually agreed. No, this is a working out of their internal struggle on you, which is what so crazy making. So what is my thoughts? Bubble wants to know, what is my thoughts about somatic healing? Yeah, I know of it. I think it depends on whether or not are you moving into the realm of more like supernatural and psychic stuff? Or are you just talking about like therapeutic yoga, breath work, EMDR, that type of stuff? So yes, there is a wing of psychology now that is integrating these modalities for treatment, and they're wonderful modalities, because trauma isn't just stored in our mind; it's stored everywhere in our self, in our bodies, and in our emotions, and all of that is super, super helpful. In fact, I've been doing somatic work with my public audience on Thursdays at 1:00. Central Standard Time. So, Bubbles, you're welcome to join us. This week, we're going to be talking about and working on emotional attunement, becoming better attuned to our emotions, learning to identify them, learning what to do with them when we feel them, dispelling some of the myths we have about emotions. So I'd love to have you join me on Thursday at 1 Central Standard Time. It's going to be just like this but Tuesdays I devote to a topic, and Thursdays I've been devoting to a guided meditation. Yeah, the link in my bio to everything that I'm doing it's in my bio. But yeah, in the future, when I get into April, you'll see me just once a week live, and that will be just doing this. I'll be doing education on topics because all the rest will be happening inside the group. So if you guys like this, please consider joining the group. It's going to be amazing. Yeah. Anne asked about couples therapy. Yeah, we do say no to couples therapy for narcissistic relationships for this reason. Often, it's not always, but often, narcissists will agree to come into therapy because they're looking to either strengthen their position, or they are like hoping to sort of contaminate the work. They want to have another person sort of triangulate the therapist into agreeing that the partner is the problem. But what happens is the minute it becomes authentic work, then the therapist flees and is angry. And that's why they then don't stay often, is for that, because the therapist doesn't cooperate. But if the therapist is not alert to that, they can accidentally become part of the narcissist's campaign, unfortunately. Or the other thing that happens is that they just use whatever they learn to get more sophisticated at being deceptive and exploitive. And that happened in my case. She just got better at hiding. Homeschool Mom, how you find it is in the link in my bio. Right at the top, it says, are you interested in learning more about Dr. McAvoy's new group? That's how you learn about it. And then I will send out more information about the group info, like when it's going to start, what tiers there are, the cost there's going to be. And I want to let you know, it's going to cost roughly the cost of a coaching session once a month. That's going to so if you know what that is, the realm of that is, that's going to be where the starting is, because so you get all of that with me on a regular basis for the same cost as if you had one appointment with me. Actually, less than one, because I don't know if you know how much I charge, but it would be less than what it would cost to have a 50-minute session with me. So lots of content, lots of support for less than what it costs to sit with me for an hour. And I'll do this and more than what I'm doing right here. Well, thank you so much for that gift. I appreciate that. So no ID 11 asked, so if anyone's only verbally abused, oh, no, that was the question you asked. I'm way behind. So I'll go back down to the top. Why aren't they called psychotic if they're so out of touch with reality? I miss what you're talking about, Sarah, so I don't know what the question is. Oh, you clicked on my narcissistic partner survey. Huh. Let me check into that, Kate. As soon as I get off this live, I'll fix it and make sure that it works. Yeah, because I have, just so you guys know, I have these links, and I've sometimes changed, the links get changed, and they're touchy. They're touchy links. I don't like that. But let Kate literally check again in a half an hour, and I'll fix it for you. Okay. But thank you. So if you guys want to know if you are married or in a relationship with a narcissist or a sociopath or a combination of both, or somebody who's capable of change, I have that survey who's available. And that's what Kate's saying right now, that the link isn't working, but I'll fix the link within a half an hour. So yeah, I like what you said, Brittany. Borderline personality disorders, great fear is a twin fear of abandonment or engulfment. Engulfment is a fancy way of saying, if I say yes to you, you'll start to control me, and I will cease to be me. You're going to take over. It will be you, not me. That's engulfment. And when you're little, think of a little kid. So like an 18-month-old, and you're putting on they're saying, me, do it. I'll put my own shoes on it. And you take over. In that moment, accidentally, as a parent, in our rush, we've engulfed our child. I know we're not meaning to do that, but that would be a great example. Like, then they get, you know how that works, is you're in a rush, you take over, you put the shoes on, and then they burst into this massive tears and scream and cry and said, I wanted to do it. And yeah, that's an experience of what a childlike look of engulfment looks like. But we also, as an adult, we don't like to be engulfed either. Nobody likes engulfment, because when we're engulfed, we in that moment cease to exist. It's a form of death. So we don't like it. And abandonment says, you're so awful, or something about you so wrong, or I can't stick around that I just won't be here for you. And we hate that too. So we don't want to be rejected, but we also don't want to lose ourselves. And for borderline personality disorder, those are the twin intense fears. But it's intense fears for all of us. It's all of our fears because that's a human fear. Just like narcissism core is shame, which then I know somebody said, no, we're not all on the spectrum. Yes, we are all on the spectrum, guys. I don't know where this therapist got the idea that we're not on the spectrum. If you have an ego and you want to be cared about and you want people to see you, you're scared of relationships. That's a narcissistic dilemma. And then when somebody doesn't see you in the way that you appreciate, you get wounded. That's a narcissistic wound. We all are on a little on the spectrum, maybe from a little, even I've heard Dr. Ramani say that. I've heard many, many theorists say that. But we also all have borderline personality dynamics. I actually got to sit in here. If you want to, like one of the biggest thinkers, I don't know if they're still alive anymore, was Dr. David and Jill Scharf. I got to hear them live. I went to a weekend conference with them and got to hear them, actually got to watch them do therapy and listen to them. And they write tomes on psychoanalysis and object relations theories. They said, we all have abandonment and engulfment fears. That's a normal thing for all humans. We all have borderline personality characteristics. Oh, thank you so much. So we should not be saying us and them. There is no us and them. We're all in this together. We're all struggling with it. But yes, you nailed it. That's a good way to put it. Oh, so Wave Wild was here. It's so nice to see you guys. Wave, I appreciate your help in building contents. That's so much. Yeah. So is RSD more of a symptom and not a disorder on its own right? RSD, tell me what RSD is, Louise. I don't. Oh, you guys are talking. See, I'm going backwards. So the overlap of ADHD and BBT, yeah, yeah, yeah. By the way, thank you, Britt, for saying that. What I've been doing every week when I get done, I do research every week, and when I get done at the end of the week, I update my resource list with whatever I've researched and then tagged and talked about for that week. So last week I added all the stuff about gender differences between female and male narcissists. And the week before, and I always add the links about whatever guided work that I did. You'll find the links about that too. So everything that I'm doing, I'm trying to give you guys resources so you can, one, check me out, make sure that I'm on task and on target and saying the right things, but also so that you can do your own research and educate yourself. Because as I notice, these platforms get this is becoming a crowded topic. There's a lot of people who are now talking about narcissistic abuse, but there's a lot of people who are not, they had it happen to them. And then they want to help people, and then they go out and they kind of regurgitate what they're hearing, but they aren't doing the harder work of really getting training and certification and a lot of education and stuff. They're not staying current. And I tell you, it's work to stay current. Even as a psychologist, and I don't know if you guys know what goes into getting my degree, but or even to be licensed, what goes into that. It's a huge thing. I mean, 4 years of college, then there's 4 to 5 years of graduate school. Then I had to do 2 years of supervised full-time work before I was even allowed to, in the state that I practice in, to practice. So it's just, we're talking 10, 11 years of work that had to be done. So be careful about that. Know who you're getting your advice. Know whether or not are they staying current. Do they know something about this topic of narcissistic abuse, which is a super new area, which a lot of therapists are not informed about. So yeah, I'm thankful that we have coaches who are in this to offer more support, but it's important you know your coach. And if you guys ever need a recommendation, I'd be happy to send you links to really good, solid coaches that I trust and believe in. So. And again, please check out my group. So and I may even provide a way to get coaching within that group. So I may kind of help you find good people to connect with as a part of this process too. Yeah. Yeah. It's interesting, Sarah. You're talking about narcissism being Nearly psychotic. Yeah, there is. So psychosis, that's literally what psychosis is being out of touch with reality, losing touch with what's real. And you lose touch with what's real in two main ways. Either your senses no longer report accurately and you begin to see, hear, feel, touch or something that's not there. And by the way, the type of hallucination that you have tells the clinicians what problem you're having. For example, tactile hallucinations tend to be more common with drug overdose, whereas hearing or seeing hallucinations tend to be more typical with a schizophrenic process. So it kind of gives us some more information. But then the other piece is you believe delusion, which is you have false assumptions that are not credible and do not line up with real life. It's like me telling you the sky is what's a ridiculous color, because it can be occasionally pink in the evening. But let's say that I say the sky is green. The sky would never be green unless there's something really bad happening. If I just insisted the sky was green and then even told you how I saw it and all the shades of green, that would be a delusion. Okay, so cluster B personality disorder sit. If psychosis, this is the best way I've found to explain it. Imagine psychosis is a chocolate covered cherry, and the cherry and the nugget inside of it, the gooey stuff, is the psychosis, the out of touch with reality. Narcissism in cluster B lives on the outside chocolate edge, but occasionally they fall into the chewy stuff. Occasionally they get a little bit delusional. And yes, part of that process, that idealization, that construct they create in their head, that narrative, that's a false narrative. It's not real. It doesn't line. I would best say how you can conceptualize it is it's like a childlike 2-year-old-ish narrative. That's about the kind of the structure of it is very immature, very primitive. And then they believe it and then they act on it and try to set it up in real life. So part of the healing that has to happen is for them to realize that they need to sort of become more comfortable with life being as it is and being complex and being messy and people being real and that they are real, and that shame is something we need to learn to get comfortable with and embrace. And they really, really struggle to do that. Very struggle. But yes, at times, I would literally say at times you're going to see people with a cluster B diagnosis show psychotic symptoms. Absolutely. I do think that does happen. I've seen it. I've actually seen it. So, yeah. Do healthy people, and this is the last question I'll take today, and you've had a lot of no ID or whatever, however you say your name, you made me ramp my game up today. I love it. Thank you so much for that. I appreciate your questions. Do healthy people try to control narratives, or only toxic and abusive people? No, I think everybody tries to control narratives. I think we're all doing it because we're trying to manage our ego. That's why I'm saying we're all on the spectrum. The more that you do it, the more frequently you do it, the more intense you are attached to that narrative, the more ill you are, the more pathological you are. That means you've not learned the skills to be able to become comfortable with not having things go in the way that you need, knowing how to regulate your insecurity and your fears on your own. The more that you're struggling to do that, then the more that you're then going to be controlling those around you as a way to manage your insecurities and your shakiness, your weaknesses. So yeah, everybody, I think just when you think of neurotic, what Freud defined as neurotic, that is a person who's more able to deal with their own internal conflict and take ownership of it and have more insight into it. Whereas the less neurotic, the more severely ill, the more we move towards a more pathological end, the more we control things and the more rigid and not adaptive we are. That's what's harmful. The more that we're not adaptive. Oh, I'm glad that my examples help, and it's to be continued. I thank you so much for your feedback on that. I appreciate that so much, and I'm glad we're friends too. Thank you for saying I'm your favorite, and I always appreciate all of you guys' relationships. I really do. I view this as a relationship that we're building. I get to recognize you guys by name, and I love it when we get the chance to kind of put it into real life. So all of this means a lot to me. It really does. You are people. You are people. Even when I'm not always happy with what you guys say, and maybe you push me into a really uncomfortable spot, I do appreciate the effort to have a dialogue. That means a lot to me. It does. Not something we can do everybody, everything, everywhere with everybody, for sure. We certainly can't. Any last oh, Brittany, you do to me too. Anything else that we should want to talk about? Any last thing before we wrap it up today? I'll be back on Thursday. Oh, I have one last thing that I would love to let you guys know is I'm going to be hosting, along with Ro and Lisa, Stronger Than Before and Roller Coaster of Love, and I are hosting a sorry men. I know there's a lot of men here today, which I love. Thank you so much, guys, for being here. But we're going to be hosting a 5-day retreat in Mexico, Riviera Maya, Mexico, in February of next year. And we're right now starting to take signups for interest. So if that's something that so let me it's called Rising Strong. And the focus of it's going to be on helping you become more confident, more resilient, take your healing to the next level, to be transformed. I'm super excited about it. It's going to include a lot of experiences like guided breath work, somatic, or kind of getting in touch with your body, with yourself, kind of taking risks. It's going to be a small group for women and very hands-on. And it's going to be the place that we're doing this at is on the ocean, Caribbean Sea. So it has its own pool. We will not be blending with other guests. You will be with yourselves as a group. So there'll be the safety and privacy to really be able to be there. We'll be having meals together. There will be a chef on there that will be making all of our meals homemade. Will not be brought in. It's actually going to be made homemade on site with a bartender. So it's going to be an amazing, amazing 5 days. So if this is something that you think you need, that you're ready to take it to a next level, you're really wanting to focus kind of in a little more personally, a little more experientially, maybe a little more intensely, please, I hope you'll consider coming. It's going to be utterly fantastic. I'm so excited, really excited about it. So check out my new club, my new group that's starting up in a month. Link in the bio about that. There's also a link in the bio if you're interested in this Mexico retreat with me called Rising Strong. I'm super excited about that. This has been wonderful. And on Thursday, we'll be doing attunement work, emotional attunement work. So if you've appreciated the guided breath work, the guided somatic work that we've been doing, Thursday at 1:00 Central Standard Time will be on attunement, emotional attunement, how to reconnect with our sense of ourselves, our feelings, how to get healthier with that, how to find safety, intense feelings that are scary. So we'll be doing all of that. And thank you so much for all of this. And I will be, was it challenging to be my own narrator of my own book? No, it wasn't challenging. I loved it, actually. I discovered I really enjoy narration. It's a different kind of work. There was parts that I was kind of triggered, and I'd never done it before. So that was my first experience, but I would narrate again. I would narrate a book again. I enjoyed the process of being a narrator. So I find, and that's why I'll enjoy the breath work too. I like doing that. It's a lot of fun. So thank you for that question. It's kind of a great question. It was, it's funny because I looked at my ratings on my book, and my ratings for my narration performance is higher than they are for the story by 1 point. Isn't that funny? But okay, Dana, I'll take your question last and then we'll say goodbye today. How do you recover when you step into a bear trap of Darvo? Oh, yes, I hate it. So for those who don't know, when you get set up into a situation when it's a no-win situation, what they do is they defend. So you bring up something, and the next thing you know, they'll deny that it's true. They'll attack you for saying it, and then they'll say you're bad for ever bringing it up. This is a very personal example, but came to my mind as one that happened to me. My ex promised that he was going to be very intimate in our relationship. He was not. So anybody who thinks I had a lot of in that relationship, I did not. So I was chasing him one day and really, wanting to be intimate and interested in it. And he said, I'm so more attuned than you. And if you were just as sensitive than me, then you would have figured out that my back hurt today and that you would have cared about that. That's what he said to me. So see what he did? He denied that my request had any accuracy. He attacked me for having the request. And then he painted the picture that he was more sensitive and that I was hurtful, that I couldn't be as sensitive to him around his issues as he was with me. He was serial cheating. That was the issue. He wasn't interested in me. So how do you avoid it? Well, if you accidentally step in, which means the minute you respond, you've stepped into the trap. the best way to avoid it is just to avoid it. Just don't respond. Don't do Jade. Don't justify. Don't attack. Don't defend, and don't explain. So Jade, don't justify, don't attack, don't defend, and don't explain. But if you accidentally do, and I did in that situation, I stepped in too, and it starts to go sideways, just the best thing you can do is just go silent and say, oh, I shouldn't have really said anything. I hear your stance on this issue, and I'm just going to bow out of the discussion. Just find a graceful way to back up, Dana, and get out and stop. And it's hard because they're leveling all sorts of unfair things that are very, very hurtful, and you're going to want to protect yourself. That's our instinct. That makes sense. It's not wrong to want to do that, but it's a trap. There is no way out. Absolutely no way out. The only way out is not to do it, which means you let yourself go be on the record as wrong. You go on the record as being attacked and wronged. So you have to find a way to emotionally say to yourself, I'm not going to correct this. And this person will believe what they believe, and I'm just going to let it go. But it's hard, emotionally hard work to do, really hard work to do. Yeah, and you're right. You said you felt awful for a week afterwards. Absolutely. It does leave you just feeling really hurt. It does. So, yeah. So if you engage, just slowly back up. Like, whoop, shouldn't have said that. You didn't even say that. I shouldn't have said that. I'm sorry. I'm bowing out of the conversation. You can even use, I think it's okay to use this. I know we say this is gaslighting, but I'm sorry that you see it that way. And I don't, but I just don't see there's anything point to continuing this, something like that. All right, you guys, this was awesome. Thank you so much for today. Thank you for your patience, for the technical problems. Like I said, Mexico, if you're interested in going, please sign up on the link. Also, please, my club is going to start in a month. And if you like this is just a taste of what it's going to be. So it's going to be way better than this. And I love my mods. Thank you so much. And I will correct that link, Kate, as soon as I get off of this. Thank you for letting me know that's not working. You guys are the best. Absolutely. I really appreciate you. I'll see you guys back on Thursday. Bye-bye.